Hi, this is Dr. Noel Lloyd with 5-Star Management, and I'm in the 5-Star Management conference room. I'm going to show you in this short video a great associateship. In fact, introduce you to a great young associate and show you what you need to do in order to get the same results in your associateships. You're getting busy. You'd like to hire an associate, but you know that 85% of all associateships end up on a sour note. Clinic directors have their list. They're unmotivated. They can't get new patients. They never make money for the clinic. They've got a bad attitude, and it goes on and on and on. But the associates have their list as well. I'm being taken advantage of. I'm being underpaid. I'm not getting trained. There's more than enough problem to go around. That's why 85% end up in the tank. Well, I was at a live training this last weekend, and one of my clients' associates were there, and I spoke with them on camera, and I want you to listen to a great associate. Great attitude, great numbers, but he was developed. He just didn't happen by accident. Listen to this interview, and then I'll come on the end of the interview, and then I will tell you exactly what you need to do in order to get the same result. To Dr. Stanton Couch, who's an associate with one of our 5-Star Management clients, Dr. Oakland Garkey. Aren't too many Oakland Garkeys in the world, are there?
No.
Okay, and so you were in a previous associateship before.
Correct.
And now you're associated with Dr. Garkey, who's taken our associateship training. So can you just compare the differences between the two and tell us how you like your current associateship?
Well, I love the current associateship. Mm-hmm. Mainly because of the 5-star direction that he's been given.
Right.
I mean, I was able to go into this practice, with no patients, and within 3 months I was seeing 150 patients, and I attribute that directly to the day 1 and day 2 that Dr. Garkey learned from 5-star.
Right.
And we've been able to maintain that 150 to 190 patients. I've been there 5 months now, and I'm seeing 150 to 190. And I really give, credit to the 5-Star Management direction. The day 1, day 2, primarily, and the blue chart has been golden for me. And which I didn't have that, at the other opportunity. Right, the other associate position.
Well, sometimes doctors in other associate positions, they just don't know what to do with their associates.
Right.
And Dr. Garkey has a training plan in place for you guys.
Yep.
Can you tell us a little bit about how that training plan works?
Well, actually, I was trained because Dr. Job was trained by Dr. Garkey.
Right.
So when I came in, Dr. Job trained me on the blue chart, day 1, day 2, because he had been doing it, all the new patients and all the returning old patients for 4 or 5 months for Dr. Garkey. And so he's the one who basically trained me, for about a 4-week period on learning the scripts for day 1, day 2, so that when I started seeing my new patients, I hit the ground running.
Perfect. That's great.
Yeah, it's been great.
So every chiropractor that we know and we work with, we feel wants to help people, wants to have fun, wants to make money.
Yep.
And because you got into chiropractic in order to be able to make a difference. You want to do that with procedures that you enjoy, and you want to make a good living for you and for your family and for your future. So you're on a track in this associateship that you've been there for how many months?
5 months.
5 months. Do you see yourself helping a lot of people, having a lot of fun, making really good money?
Absolutely.
What would you say to somebody who is considering, first of all, the associateship training that 5-Star provides? So clinic director is looking, and he may not have had the experience with his associates that he wanted to. What would you say to him?
I would say you have no idea what you're missing out on. I mean, it is dynamite. Like I said, I hit the ground running, and all my buddies that are still out in practice, I mean, they're struggling to see, 150 to 190 or 200 patients a week. And it's just because they don't have direction, that you got to have direction, you got to know your scripts, and if you're just wandering around without that direction, I mean, you don't know what you're missing out on. I mean, it's been dynamite.
So for the associate and the clinic director, you'd say the 5-Star system works really, really well. There
Absolutely.
are other associates in your program too. Yep. Are those guys happy?
Yeah, they're doing great too.
Super.
Yep.
Super. Well, here's to your success. May you help many, many more people have more fun and make a lot of money.
Absolutely.
Okay.
Appreciate it.
Later. Bye. Wasn't that great? Now, did you hear what they were saying? that they credit the training that they got as a result of their clinic director getting win-win associate development training from me. And then they talked about specific things that they were trained to do. One of the things that they didn't cover was marketing, and there's a lot of training that goes in on that as well. If you would like to have a better associate experience than you've had before, if you'd like to have associates that sounded like this young man, then one of the things I would really encourage you to do is to come to the Win-Win Associate Development System training with us in Las Vegas. Now, the dates and location and registration information are on the bottom of this video, right about here. Now, we usually sell this seminar out. It's extremely popular. We workshop all the major topics. I'll answer your questions. I've done 72 good associate positions. I've sold 10 clinics to associates for cash. I will teach you what I did. I'll show you what other five-star management clients are doing in order to have great associate relationships that the clinic director likes and the associate likes. This is why we call it win-win. Hey, this is Dr. Noel Lloyd for 5-Star Management. If you like this information, if you think it's fun, if you think it's helpful, would you like us on Facebook? Would you follow us on Twitter? We'll see you at the seminar.